Hello Uganda, my name is Mwanguzi Shadrack from Health Touch Uganda. Today I'm going to be talking about something very important. We are in a state where everyone is worried. Our beloved ones are dying. People we have lived with that have had chronic illnesses but have been living with them are dying before time, all because of the pandemic. So I'm going to try answering some of the questions that have been directed to us for now some good time and see that someone benefits something. I'm going to be majorly talking about home care for families and caregivers. People who are tested and results come out positive, and they may need to benefit from home care or home-based management. So I'm going to be talking about some of those things, answering the questions which some of those people ask, so that even when you're going to have home-based treatment or care, you keep safe and the rest of the people around you. So some people ask, can someone who has tested positive for COVID-19 be cared for at home? In the early days of this pandemic, you remember all the people that tested positive would be quarantined, and their contacts would also be traced and quarantined. That was aimed at stopping the spread of this virus. But because it was widespread, and now we are in a stage where it's practically not possible to quarantine everyone that tests positive, to trace all the contacts, we have resorted to home-based management or home-based care. So it is possible and it is advisable, especially for people who don't have severe symptoms of the illness, people that don't have very high risks, that don't have comorbidities, we call them comorbidities, or other illnesses that put them in danger. So people without cardiovascular diseases or diseases of the heart, people that don't have diseases like diabetes, where you have high sugar levels, people that don't have lung diseases, cancer, long-term kidney diseases, other diseases that weaken your immune system, people who are not very fat or obese are advised, and they don't have complications or severe symptoms like difficulty in breathing, whereby when we check your oxygen levels, they are very low. When we look at your chest, the way you're breathing with difficulty. All those people, we advise them to receive care from home. And when you are receiving this care from home, it's better to get in touch with a health worker, because you might be fine today, by tomorrow the situation may totally be different, and you may need to raise someone and ask them or tell them about your condition, so that they advise as early as possible. So if you can get a contact of a health worker, please do it. I want to leave that question by saying it is possible for someone who has tested positive for COVID to be cared for at home. Other people ask, what should be done to prevent other people in the house from becoming sick if a person with COVID-19 is being cared for at home? There are a number of things which we can do or which we have to do when we are receiving COVID treatment or care from home, and all these are directed towards protecting others. It's funny that when some people test positive for COVID, they don't want the rest of the people, even people at their homes, to find out that they have tested positive for COVID? Well, because of the stigma that some people go through, but as a patriot, as someone who wishes the rest of the people well, I would advise that you reveal to the people you stay with about your positive results so that they are protected. So, if it's possible, the person who has tested positive should stay in a separate room. And if this is not possible, then try to keep some distance from the people you're with in the same room, at least 1 meter from them. And in the house or in the room, make sure the windows are open. Make sure there is enough air coming in or flowing out. Number 3, the person that has tested positive should ensure to put on a medical mask. There are these improvised masks, the ones we make from clothes, from bitenji, and those other materials. But it's better for a person who has tested positive to put on a medical mask. They are sold on the streets, in pharmacies, and all over the place. So if you can get medical masks, it will be better, especially when there is another person in the room. It's better to limit the number of caregivers to the person that doesn't have underlying conditions. That's if it's possible. From the people at home, choose the person that is fit, that doesn't have other underlying conditions like the ones we mentioned up there: diabetes, kidney disease, lung disease, cancer. The person whose immunity is strong to be the one taking care of the sick person. And the caregivers plus the people that stay in the house, in the same house, should also try to put on masks. If they can afford medical masks, the better. If they can't, just put on any mask that you can afford to have. And when you are using these masks, make sure not to touch the mask in the process of using them. The person that has tested positive for COVID should have their own dishes, cups, eating utensils, towels, bed linens, because the virus, like we all know, it spreads through those droplets that come out through the mouth, through the nose, and this can land on some of these things. So make sure to use different things and not share with the rest of the people. And the surfaces, all the places that are touched frequently, should be cleaned and disinfected at least every day. And everyone in the house should wash their hands with soap and water regularly, especially in moments maybe after coughing, after sneezing, before you prepare food, before eating, after using the toilet, before and after caring for the sick person. When the hands are dirty, ensure to wash those hands and get cleaned. When you're coughing or sneezing, make sure to do that in an elbow which has been bent, we say a flexed elbow, so that you don't spread this in the entire space around. And the waste from the sick person should be treated with a lot of care before it's disposed of. So those are some of the things that you can do in case you are receiving care from home. Those are some of the things that are important and you should do. Some other people ask, how long should people with COVID-19 stay at home and in isolation? I want to say that it's important for a person that has tested positive for COVID to stay in isolation until they are no longer able to transmit the virus to others. I want to say people with COVID-19 who are receiving home treatment should stay at home and ensure minimum interaction with the rest of the people until they are out of danger and until they are not able to spread this virus to others. So those with symptoms or people that feel a certain way or things that are unusual should stay in the house at least for 10 days. We start counting those 10 days from the day you started feeling those symptoms like fever, symptoms like flu, symptoms like cough, general body weakness, loss of appetite, loss of taste, dizziness, all those things. You start counting the days from the day you first felt those things. They may not all have come at once, but even if you start feeling one of them, you can start counting and isolate yourself for at least 10 days. Then for at least 3 more days after the end of the symptoms, or when those things like fever have gone. The people who don't feel any symptoms, just 10 days are enough for them. So bare minimum, we can say 2 weeks. After 2 weeks, you can now freely interact with the rest of the people. And if you wish to, you can repeat the test. You can do a rapid COVID test after those 2 weeks and see if it's still positive or negative. Most of them turn out negative if it was positive at the very start. So those are some of the things I wanted to talk about today. If you have any other questions that you feel we need to address, feel free to channel them through the appropriate platforms: Facebook, Instagram, Telegram, Twitter, WhatsApp, YouTube, and we shall be able to see them and respond to them accordingly. It's Health Uganda everywhere. On WhatsApp, you can send a message to 0753924896 and request for the link to join any of those WhatsApp groups and receive direct access. Mwanguzi Shadrach, Health Uganda, follow the light.